I'm Adair Hall, and this is my persuasive speech on why every school should test every kid for ADD at an early age. The date is July 17th, 2014, and here are my people. Yay! I just don't like when I cut my head off. Justin Timberlake, Will Smith, Michael Phelps, and Jim Carrey are all celebrities that you may know that have been diagnosed with attention deficit disorder. According to American Psychiatric Association's Diagnostic and Statistical Manual of Mental Disorders, ADD is characterized by a persistent pattern of inattention and/or hyperactivity or impulsivity that is more frequent and severe than is typically observed in individuals at a comparative level of development. I'm sure many of you know or have met someone in your life that's been diagnosed with attention deficit disorder. Have you ever been given the chance to sit down with them and talk to them about how it affects their daily life, or how they've had to change their learning or study habits to become more successful? ADD is a disorder that alters one's ability to focus. If schools were to test every child at an early age, they would be able to catch this disorder early enough to help the child learning and study techniques to help them become more successful. Also, no one family or child would feel targeted because every single child would be tested for ADD. Another reason is that the child would be able to get the help and benefits they need throughout their education by having the correct documentation. While doctors are needed for a diagnosis for attention deficit disorder, schools can still give a pretest or pre-screening to every kid and then give them the reference to a doctor for more extensive testing if needed. So why would schools test every child? Let's look deeper into it. It is critical that ADD is caught at a young age. Why? It's so that every kid can get the help they need from their parents, their teachers, and their school. Based off info from DoSomething.org, the main symptoms of attention deficit disorder are inattention, distractibility, fear, anxiety, slow cognitive thinking, daydreaming, procrastination, and poor memory retrieval. Teachers can do many things to help kids that have been diagnosed with ADD if they are aware. Something as simple as moving a kid with ADD to the front of the classroom and away from windows can help them be less distracted and less likely to daydream. Schools can also do something to help if they are aware. When a child is classified with attention deficit disorder, that child is entitled to have their school come up with an IEP, which is an individualized education plan, or another kind of plan, which is a 504 plan. These are formal plans that describes how the school will support a child's educational needs and what they will do to help them and give them the environment they need in order to be successful. Not only can a school help, but parents can help as well by supplying organizational skills, distraction-free environment at home, and consistent routines. All of these have been found to have huge effects on the learning habits of children with ADD. Cheryl Carter states in her book, Organize Your ADD and ADHD Child, that it is of primary importance that children, particularly those with ADD, be instructed in organizational skills as early as possible and not merely told what to do. Also, if it's a severe enough case of attention deficit disorder, a child can be put on medication to get extra help. While teachers, parents, and schools have tremendous help on the effects of the child's ADD, it may not always be enough. Some need help to reach their full potential with medication. In severe cases, there are many different types of medication that can be used to help kids focus. If a child is unaware of ADD, they wouldn't be able to get the help they need from their parents, their teachers, and their school. That is why every kid should be tested. Another reason every kid should be tested is that no one family or one kid would feel targeted when a school suggests that their child should get tested, because everyone would, and it would become a norm. This also takes care of the first step of parents getting their child tested. It also gives them a peace of mind, and they don't have to wonder if their child does or does not have ADD. And it would also keep them from being upset, from being targeted out, like I said earlier, because it would become a normal thing, a normal, regular thing to have every child tested. The last main reason to test every child at a young age is so that they can have the right documentation in order to get accommodations later on in their education, especially secondary education. The Association on High Education and Disability requires evidence of early impairment to receive academic accommodations in college. Specifically at Clemson University, documentation has to follow the guidelines of the Association on High Education and Disability that were amended in 1997. These guidelines state that because ADD is by definition an early childhood disorder, it is essential that evaluation contain a clinical summary of historical information establishing presence of the disorder in childhood. The evidence must include multiple sources. These sources can include many things, such as report cards, teacher evaluations, which they wouldn't be able to fill out if they weren't aware that the child had ADD, the IEP plans or 504 plans, which the child wouldn't be able to have if they were unaware that they had ADD. Without any of this documentation, a student could be turned down in college from these accommodations that they probably need just because they weren't tested at an early enough age. Another thing about testing every kid at an early age is that the kids that were documented to not have it would not be able to get the special treatment later on just because classes were getting harder or their learning was getting more difficult. While these 3 reasons are very good reasons, they are only just a few of the many, many reasons why all children should get tested for ADD at a young age and why the school should do it. Education is essential in today's world. We need to make it capable for all kids, even those with a disorder that make learning very difficult. Testing a child at a young age helps everyone. The ones that pass, it gives them a peace of mind. It also gives them the correct documentation that they do not have it. The ones that don't pass and fail and end up having ADD, it gives them a chance to take the right steps to reach their full potential and receive the help they need from their teachers, their school, and their parents, and sometimes medication. It also helps the schools accommodate for not only those who do end up having ADD, but the ones who don't, and giving them the correct environment they need in order to reach their full potential. The earlier you know that you have attention deficit disorder, the better. So you can come up with an IEP, you can set good habits of learning and studying, and you can get proper documentation. While living with attention deficit disorder is not the easiest thing, I would know, it's definitely not the hardest and can be made much easier with the right steps. The right step is to get kids, parents, and schools aware and informed as early as possible so that they have a chance to do something about it. And the only way to do that is have every child get tested at an early age. Thank you very much.
Woo!